Afternoon, and Dr. Yaffe, I'm giving her today off, but we'll probably be back together again. We'll see her next week. It depends on meetings, and we each have to cover off on that one there, and she covered yesterday while I was at the other meetings. So to give you some updates of how we're doing today, and again, the tests and the results we have today were submitted on Thursday and done and undertaken yesterday. So let's go to the numbers, and then we'll talk about what does that mean and how do I see that data reads. So we now have 13,995, just about 14,000 confirmed cases of COVID-19 in Fort Ontario through the IFIS system, the Public Health Information System. So the increase from yesterday in the IFIS system is 476. And last number of days, we've been dealing with numbers in the 600s and at best in the upper 500s. So that's a shift. I'll talk about that in a moment. The demographics, the spread of that, age and gender is about the same as it has been all along. Most of the cases tend to be covered in the Greater Toronto Area, about 60%. Our deaths are 811 deaths in the IFIS system. That's an increase of 48, and we'll talk about the long-term care ones in a moment in there. And we now have 7,509 cases resolved. That's approximately 54% of the cases, and there'll be more following as we move along. Number of healthcare workers who have tested positive is 1,817. That's an increase of 13%. And so on the long-term care data from their database there, we took out the possible ones, and now the total number of outbreaks, whether they're being suspected or otherwise, has increased by 5, so it's 145 in that. And we had a further 52 deaths, unfortunately, in the long-term care homes. That increases it up to 625, and still only the one healthcare worker back in the past. So that was there. It's interesting, and we'll talk about the hospitals first. The hospital rates, they had another further 15 in the hospital, so that's up a little bit, which we're watching closely, and the ICU is just up a couple, which means it's pretty well status quo. Same as the ones on ventilator, up 2, which is, I would say, fairly well status quo in that regard. The total number of tests so far undertaken is well over 217,000 cases, and we have 8,171 in investigation. So we'll talk about what that testing means and how we are. So if we look at the data and the numbers there, in the 476 confirmed cases yesterday, and remember we're up at 600, well over 650 yesterday, and the flow of the specimens in. We did another 10,578 tests completed yesterday. 13,000 were submitted, and I'm going to suspect that as we're undertaking, as we've been asked to do from the public health sector, to do a very assertive agency-wide screen of a number of long-term care facilities throughout the province. And that's being undertaken with full press late in the week and over the weekend. And we'll have much of the task completed by early next week and completed by the middle of the week. That will add a lot more testing to the samples there. So we take that 476, and we know that there's just about 200 of those were in the long-term care. So you can see that our community ones, and again, this is not an exact one-off database, but about half of our total cases each day tends to be that long-term care group, and that may be actually shifting up more as we do more and more testing, so up to 50%, 60, and 70% of that number. That may be optimistic to say, okay, we're under 300 in our community cases. And remember, I was talking about that magic range when we start to get optimistic about getting back case containment and case contact management writ large. So we're getting closer in that range, so that's encouraging. The other thing that's encouraging is that as we go about all this testing, we expect to find some more cases. Therefore, the metric we look at, as I said, in the flu season and other ones, when we can tell how active it is and how much is in the community writ large, is we look at the positivity of the tests. So at the start, it starts low, and then it really ramps up as you get more and more of the community infected with it, and more people coming forward and getting tested. So as I said before, at the beginning of April, about the 8th, we peaked at around 12.5%, nearly 13% positivity. It has been dropping steadily, and even last week on Thursday and Friday, it was 7 to 8%, and today it's down to 5%. That's a significant drop. and that's very encouraging. Again, it's one day. Let's see what happens over the weekend and early into next week. So in the overall messaging is that it looks like a number of metrics are going in the right direction. We're working assertively with the IMS table. That's the incident management team under Dr. Kevin Smith, dealing with the long-term care and laying out a number of steps in there, including you've heard even some more announcements from the Premier today about the trying to encourage the workers and to have that involved, the orders to help with the hospital staff that can go over and assist with the long-term care facilities. All these are very important things to give that committee, which I get to sit on, the advisory, and to move resources quickly into those long-term care facilities that not only have a suspected, a very small early outbreak, but are actually having a sudden increase in not only cases, but unfortunately deaths, and then staff being laid off due to need for quarantine and positivity. So you got to move in a lot of staffing resources, including the early days of using our Canadian Armed Forces personnel from the federal government, which is indeed most welcome, along with using whatever resources we can from the hospital sector and others to help out in this area that's the staff are under a lot of stress and duress, to give them assistance during that time so that the residents are not left unattended and get the full care and package and services during this time of challenge in those homes. Those number of cases are in less than about 20 of the homes. They nearly 700. So a lot of them are in either not outbreak or in maybe just one case that's being followed. So we're going to go out and test a lot of those ones there, especially ones that are more of concern, and we hope to have some more data coming online next week when we look at that. We've also had some early discussions with our modelers on the long-term care aspect to see how are we faring there, as they noted that the peak in that one will not be the same as the peak in the hospital. It'll be delayed, looking at maybe sometime into the early parts of May. And again, the main issue, they said, is we need more data. And so part of doing the surveillance is to give them more data so they can do some even more modeling and give us better predictions, if you may, on how we're doing, what more should we be doing, what should we change and altering to try and impact and bend that curve, because it's already, instead of being a sudden peak, if you look at the data, the deaths even in our long-term care homes are more of a gradual one. So we have flattened that curve. We would like to really bring it down and I guess plank it was the term we used before in that line there. So some steps have worked, more steps need to be done. We're moving into more on retirement homes and in our congregate settings and doing our risk assessments of those, and follow along with, we've done already 47 outbreaks in the various ones, and working aggressively with our public health while doing the others, not ignoring those ones, especially the ones of concern, where there could be a lot more cases that are more vulnerable. So a number of things, many happening in that regard there. Some extension of the emergency orders from the Premier announced, as well as some things we have modified. There was the announcement in the press release about the consideration of the community gardens, which was deemed to be a food security issue and was placed in a different category than other aspects. And so we have listened to those issues and put that more under the local municipality and the local public health department to work with their community groups, which is under their auspices, to how they would do that in a safe way, maintaining the physical distancing, and yet trying to help them to do the issue of providing the valuable food resources for those individuals in need on a food security type portfolio. So those are my summaries of the overall situation, and I'm going to open up for questions.
Okay, we'll go to the phone lines. We'll take questions from the first caller.
Your first question comes from Carrie Verma with CBC News. Please go ahead.
Hey, Dr. Williams. Where are you at on those risk assessments? Do you know how many are completed and how many are you concerned about based on the data you're receiving from them?
Which sector you're asking? Risk assessments of long-term care?
Sorry, for the long-term care facilities.
Oh, the risk assessments have been done. They have classified them into various categories based on working with the IMS group and with Ontario Health and Public Health to look at a number of factors that go into a scoring to classify them either as in green, as in being able, capable, ready or prepared as best they can for dealing with COVID-19 and outbreaks. Yellow, somewhat prepared, needs some more aspects there, and red, maybe not well prepared and needs some insertion of more resources such as PPE, infection prevention, control, education, and I guess aspects there, including linking some of the multi-units and putting no less than 4 people in the room down to 3 and 2, and if you have space, even to put them separate. So none of these things are in place there, as well as the ongoing testing and monitoring. So that determination has already been done, and they will change as they get improved. You could go from red to yellow and yellow to green and all the ways there. We'd like to see everybody green, but we'll keep driving at that time.
Follow-up?
And sorry, so how many are yellow or red?
Now, I know haven't got the total yellow in front of me. I know the red was around about 85.
Okay, next question.
Your next question comes from Salman Farouki, Canadian Press. Please go ahead.
Hey there. The growth rate of the virus was just at 3.5% today, which to me is notably lower than in recent weeks. How much can we read into that number for the province's plans with lowering restrictions?
Just to start, you think the which rate was 3.5%?
The growth rate, I believe.
Gross rate? Growth rate. Oh, sorry. Thank you. Correct. The growth rate, that means the growth of our cases has been reducing, and that we talked about that a week or so ago, and that's what the federal people put out as far as seeing in each province. And that case, there's a sense that in the pan-Canadian basis, all the provinces are coming down or plateaued and coming down. So that low rate of 3.5% is encouraging. It's one of the metrics we use, and it's not the only one, but that means your rate of increasing is dropping in overall. We know that some rates in some areas, in fact, are not increasing to 3.5, they're less than that, but some other areas, as in the long-term care side, is still increasing. So that was an overall average that's encouraging, but you'd have to break it down into categories and groups.
Follow-up?
Okay, and Trudeau said today that plans to reopen the country do not depend on the idea that people are immune to catching COVID-19 a second time. And he said there's no evidence from the WHO yet to prove that that's the case. So could you comment on how the province is taking that into account as discussions about reopening parts of the economy continue?
So, yes, and that's part of the evolving science in different aspects. When you hear about these reinfections, of course, one has to be sure that the person was initially infected. And that may seem odd to say, but if you take a person who is swabbed and they may have the presence of some virus, they may not have had enough infection to give an overall, the term is viremia, and that you need that to stimulate the whole immune system and develop an immune complex. And there you need to measure that through the so-called serological testing. And so we're looking into that on a go forward. There are some serological tests out there now. Unfortunately, they're not as sensitive as we'd like them to be, and the interpretation is less than obvious in that. We are looking for the more sophisticated ones to be coming out. So in that sense, can you then assess someone to say, are you immune or not? Because if you're not immune, then you could get it a second time. And so some of these tests out there could give you some false, that are out there now, give you some false pretense, and then you get infected and you wonder what went wrong. So again, if you're going to do testing, you've got to make sure you can rely upon it and that you're sure that the person does have immunity, and then to give them some sense of confidence. So in a way, we're going to watch that. We hope that the serological testing we hear might be available over the summer, and then how we're going to utilize that on a go-forward basis is another further caveat and aspects as we deal with our population-wide assessment and how we continue to roll back public health measures and dealing especially with areas of distancing and congregate type gathering settings.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Dr. Williams, just to put a bit of a finer point on the question about the World Health Organization today, is the idea of an immunity passport any part of the province's planning for coming months?
Yeah, that's sort of what I was getting at. I knew they were talking about this point, especially for international travel, and I guess why they use the word passport. And again, what's important is, does one have really good documentation that one does have immunity? Much like we talk about with measles, what does one have evidence of an immunization, which right now for COVID-19 we don't have. Someday we hope to, and that would be proof of immunization, which if it has a high success rate, as it should, of inducing immunity, then you would know that people who have been immunized are 90-odd% sure of having immunity. The other way is to make sure your testing, as I alluded to, is good. Is it sensitive enough? Does it give you the right markers? And I don't want to get into too much technology here, but there's immune globulins of different types, G's and M's, such that the evidence there, the group can say, this person has good evidence of immunity. With this one, we're not so sure about. So we want to make sure the testing is good, the testing is available, and the interpretation of the testing is evidence-based and proven. And so therefore in that, if the WHO is talking about for international mobility, if you have that sort of documentation, they may allow much more international movement. That's of course in their purview, but right now here in Ontario, we're working on our issues here of control, containment, and then how we're going to come out of our public health measures and our framework on a go-forward basis.
Follow-up?
A bit further on the testing, obviously you talked about issues regarding, false positives or false negatives. Has there been any issues with Ontario's current testing producing inconclusive results? I know you've talked about some cases needing to be tested multiple times. Is that part of it?
No, I mean, we did have, as you remember, this is going back a while, and this is 3 months now today since we had our first case here in Ontario. And as you recall, back then we started off with looking at our testing. We were doing our confirmation with our National Medical Microbiological Laboratory in Winnipeg and with our other labs in Canada. So we were very, very careful to make sure our testing one was specific for COVID-19, because remember, the testing did not exist before. And because we had the gene sequencing, we could do some much more assertive action in that regard. Then as we got that testing out and running, and we were getting, remember the time of the probable and the confirms? We did that with the positives and the negatives. And then we started looking at even a more sophisticated testing, without getting too technological, the 1 allele going to the 3 allele, if I can get on that. And we tested that one there. Remember we had the one case where there was a person who had tested negative with the 1 allele, and when we did the 3 allele, it was sort of positive. And so we thought, was that a false negative or not? In the end, it was very mild, and the person was basically became resolved fairly quickly anyways. But that's the closest we got on there. We continue, and our lab continues to check with other sister and other partner labs around with some cross-checking for quality assurance to look at those issues. Are there issues of false positivity or negativity? Because one wants to make sure that you're doing the best you can. You have high specificity, high sensitivity, and we feel our testing on Ontario and Canada is in that level, and that's why we're not adopting all sorts of new things very easily or casually, because we have to run them through the testing method to say, are we confident these other alternatives have the same level in that regard? So it's an important question. Thanks for asking.
Last caller.
Your final question comes from Morgan Campbell with Global News. Please go ahead.
Hi, Doctor. Today there were about 100 people gathered on the front line of Queen's Park. Some may have been, not following social distancing rules. What's your reaction when you see something like that, and how dangerous is that type of grouping of people? It's a significant number.
Well, as the Premier commented, and I would agree, I didn't see it per se, but when I came in, I saw lots of people on the street. I would say getting lax on the social distancing, not wearing masks if they are in close proximity, because remember we have said the 6-foot distance and no group greater than 5, especially it's supposed to be a family unit or a couple. And we want them to do that, or wear a cloth facial covering, mask if you may, if you feel that you may have to be in a situation where for a few minutes you're compromised and can't maintain your 6-foot distance. We have seen the success of that and how that's really flattened down the curve in our hospital use. As the numbers that I talked about, we were in the 600s last week. Today we got 400 today, upper 400s, one day only. Let's not get too confident. Let's see what happens over the weekend into next week. So there's a sense like, okay, let's just get casual. That is really the wrong thing to do at this stage, because when you're getting close to finishing in that and completing that, you need groups like that all of a sudden, you've heard it before with some of these other larger gatherings in which we're coming into this, where there was infection spread at those large gatherings. And people thought it was quite okay, but it wasn't. And people often, we're still finding cases where, well, we started to get together, but we didn't think it was a big deal. But then we found out someone was a case, and now we're all down with it. And they're wondering, why did this happen? I have to ask myself that question as we're going forward with our testing, as we get into a case contact where people say, I'm positive, but I don't know. I didn't travel. I didn't work in the hospital, a healthcare worker. I don't know what happened. You say, well, something did. You came in contact with someone. It just didn't happen. And so were you not consistent in your behavior? And usually we find out probably not. And that's disappointing, because that continues to impact, because then all the people, some others you continue to do that with, you're spreading it and you're slowing down. The same thing they're protesting is that if that keeps up, then we have to slow down the public health measures ramping back, because we still have a lot of active community transmission. So it seems odd that one would do something that would actually counter what one's hoping, because just like the people I think were protesting, I assume the issue was rolling back. I know the Premier is very concerned about getting the economy started, and recovery plan, he's announced that he's going to be talking about that next week. And that's a very important thing for us. But that means everybody has to stay the course. And we didn't get here just by happenstance. Everybody did what they did. That was really valuable. It was a great investment by Ontarians. And most Ontarians would say, this is not important now and come to near. As it goes into the summer, if you back them off, we're still going to be looking for that. We still want to be careful, because this has been a change for us. And we're careful. It's protected us, our loved ones. We've seen some people it didn't, and some died. And it's not a benign thing. It's not a trivial thing. So I think our Ontario residents, for the large part, are saying this is a matter to be taken seriously, not only today and tomorrow, but probably over the summer and the fall. They're going to say, while you may bring some things back, we want you to be careful, because we don't want to go back and repeat this again. So that my response is, I would think that we need to have people to continue to be highly responsible. And in time, we will, with some caveats. I said there'll be some yes buts, and you can do this, but you have to do this and this and this. And I think our public are saying that only but makes sense. So we're hoping to be able to come up with those kind of aspects and some direction on that next week from the Premier.
Follow up, and this is the last question.
Dr. Williams, I wanted to get your take on this. New Brunswick relaxed some of those rules. They announced it yesterday, opening up beaches, opening up certain areas, allowing people to gather with 2 households. Will Ontario be looking to our neighbors for, a little bit of advice on how that has been working out? I mean, let's keep in mind that New Brunswick's population is that of, an Ottawa suburb, essentially. But we can learn a lot, some would say, from what's happening to the east and the west of us. Is that something you would be exploring to see how, walking back on some of those rules may be good or bad? I mean, we have a good example here of somebody who's, doing it first.
Excellent question, and I couldn't agree more. I think that this is not a race, first out the gate. Those provinces, New Brunswick, Saskatchewan, and PI, much smaller numbers. Some haven't seen any cases for a number of days. And you're correct, you're dealing with populations that are like some of our larger cities' suburbs, or some of our smaller cities here in Ontario. So Ontario is quite a different entity, and a bit closer to Quebec in that, so we have much more complexity with a number of unique things. But by watching that, as we said already, watching what they're doing in China with the opening up in there, they're seeing some secondary issues that we're trying to watch and see what does that mean. It will be informative to see how that works, knowing that the smaller populations spread over quite a large area, and their dense urban populations are even less dense than ours. So always wanting to learn, always wanting to watch, because we would like to, when we make decisions, not to backtrack. And the more we can learn and observe, the more confident we can be going forward, and the more the direction that the Premier is looking for is assertive direction forward and not backstepping if we have to. And we want to do all that with the best information possible. If our fellow provinces and territories around the country can give that to us, including other countries, we're watching that, our experts are watching that, and we're trying to keep as informed as possible to give the best advice to the Premier and government as best as possible. So it's a good point, and it's all early days, lots to watch, lots to do, and we're just like spring. It looks like it's coming. We look like our numbers are going the right direction, so we hope to be able to give you some more positive direction in the future.
Thanks, everyone.